Hey guys, welcome back to my channel. If you're new here, my name is Jessie, and first of all, thank you for checking out this video. I really hope you enjoy it. So in this video, I'm going to be telling you 5 different things that I feel like you should study and know before starting nursing school. These are things that I either did study myself before starting my program, or things that I feel like I should have learned and should have got ahead on before starting. So my first tip for you guys is to brush up on your math skills. Now in nursing school, you're going to have to learn to do a lot of different dosage calculation type questions. These are math questions, but they're all based around calculating the correct dosage or drip rate for fluids to give to your patients. So before I started my program last year, I was told to learn 4 or 5 chapters in the dosage calculation book before starting the program. So basically I had to teach myself a lot of content over the summer before my nursing program even began. And we had a dosage calculation exam in the second week, I believe, like literally like the 3rd class of the semester. So it wasn't like they taught us that and then tested us. We had to know that before even starting. And in our school, if we fail the dosage calculation, we get 2 more times, but if you fail that 3rd one, you are out the program. We have to get, I believe, a 90% or higher. So it is obviously very strict, but that makes sense because it is such a vital part of being a nurse. So the things that I would recommend knowing beforehand are how to calculate flow rate. So if we're giving IV fluids to a patient, we need to understand how fast to give those fluids to them. Also, if you can calculate drip rate, that will really get you ahead of the game as well. We didn't learn drip rate until the 2nd semester, but again, it's one of those things, if you know it, and you're going to be ahead of the game, so why not just link it in with flow rate and get it done. And also, probably the main thing, learn how to calculate medication amounts based on a person's weight, and also learn different types of questions. So if the question asks you how much should we give him based on this weight, for example, it might not ask you for that one dosage. It might say, okay, this patient takes this medication 4 times a day, so what is his daily dose? So really learn how to read those questions because they often do trick you. Learn those 3 or 4 different types of questions and really get used to them. I'm sure there's plenty of resources online. Practice dosage calculation questions. Obviously, if they've given you textbooks, really read them, practice, get ahead, and hopefully this will help you. Next thing I'm going to recommend you learn are your lab values. Now these are so important to being a nurse. We are expected to pretty much know all of the general ranges for your lab values in the 1st semester of nursing school. They are always kind of adding a few more on, but the vast majority of them we do need to know from the get-go. So if you're able to identify if your patient has a lab value outside of the safe range, you're going to feel so much more confident in dealing with that patient. Even if you don't feel like you can do much as a student nurse yet, you being able to identify those issues if they arise, you can go and tell your preceptor, you can go tell your head nurse and get what needs to be done for your patient, and it's just going to help you tremendously once you're in the hospital. So if you can know these figures beforehand and not have to worry about learning exam content as well as lab figures, then you're going to feel so much more secure. So the main ones that I recommend you learning regarding the blood are H&H, which stands for hemoglobin and hematocrit. I may say that a little bit differently because of my British accent, but you will always see H&H on the lab values. And then red blood cell count, white blood cell count, plasma, platelets, PT, which kind of relates to clotting factor and the time that it takes for your blood to clot. Then also learn your arterial blood gases. These are often referred to as ABGs, and again, I'm not sure when in your specific school you're going to learn these, but if you know them from the get-go, trust me, it'll help you a bunch. Also learn your electrolytes. Now with electrolytes, there are a whole bunch of different ones that you can remember, but the main ones I would say are sodium, potassium, chloride, phosphate, magnesium, zinc, creatinine, BUN. Yeah, that's a lot. There are so many you can learn, but if you type in like nursing lab values, nursing electrolyte values, you will find a good list. Some of the figures that your school uses might be slightly different to what the hospital uses, but as long as you know the general range and can identify that, you know, if a figure is 10 over that range, you can identify that that is obviously unhealthy, then that is going to help you tremendously. Try not to worry about like the specific, you know, 1 figure difference, because I stressed about that a lot in the beginning, and then I realized, look, like the hospital is not going to stress over that 1 tiny figure, but if they are 5 or 10 or more over or under that ideal range, then that's when we have to start worrying. So as long as we can recognize when things are not good or are safe and in the good region, then that is the most important thing. There are a lot of different values to learn, and I understand that, but if you can maybe learn like 1 or 2 of the values a day, then by the time you start your program, hopefully you'll be able to memorize most of them. So this next thing kind of relates to what I was just talking about regarding the lab values, all about hypo and hypernatremia and hyper and hypokalemia. So if you've never heard of those phrases, basically it refers to either having too high or too low sodium levels or too high or too low potassium levels. Natremia refers to the sodium and kalemia refers to the potassium. So these are 2 very, very important things that we need to understand in nursing school and are vital when you're in clinicals. So if you can learn the values that are safe and obviously then identify when they are out of the safe range for both sodium and potassium, great. But if you are also able to learn some of the science of each condition, then that will really kind of get you ahead. One of the things that I wish I'd done before starting my program is take a medical terminology class. And basically this is because when I first started my program, I felt quite behind a lot of other students. I'm sure there were a lot of other people that felt like me as well, but there were also a lot of students who were very advanced medically speaking, whether they were CNAs, PCAs, you know, surgical techs, EMS, whatever they were doing in the medical field, they clearly had a great grasp of medical terminology and just being able to have a general conversation about the medical world. So many times I was sitting in class and either the professors would mention something and I would just be sitting there like, am I meant to know what that is? Like, I'd kind of be looking around going like, is anyone else confused? No, just me? Cool. I'm sure a lot of other people were in the same mindset as me, but then there were also students who would either ask questions or, you know, answer questions, and the things that they would say, I'd just be like, you sound like a doctor, like, yeah, I have no idea what you're talking about. So yeah, if you can take some sort of medical class or train as a CNA or a PCA or whatever it is, if you have the time and money, I understand not everybody can do these extra things, but if you are able to, honestly, it is definitely worth the investment, and I totally wish I had done it. Okay, the last thing I'm going to talk about is not something to necessarily learn, it's something to practice, and it's the type of questions that you have in nursing school. Now, this isn't something obviously that's going to help you in clinical settings, but it's going to get you through school and help you pass those exams, which is equally as important to becoming a nurse, because if we don't pass the exams, we can't be a nurse in a hospital. But basically, I've talked about this in other nursing videos, but the type of questions that we have in nursing school are completely different to anything else. If you have done A&P or chemistry or anything like that so far, you know that a lot of the questions are based on kind of memory recollection. It's not like that in nursing school. Obviously, we have to know the information, but the questions are never that straightforward. They'll never say, what is this, or which one is this, for example. It will be almost like a case scenario. They will give you a situation, hypothetically, and we will have to determine the best course of action or the best response, the best medication, blah, blah, blah. Obviously, it's what you would expect to be doing in nursing school, but it's very, very different, and if you aren't used to this type of question, it can really throw you. A lot of people, I think, me included, we know the content and we know the information and we know how to prioritize in the hospital, but when we're answering the nursing questions, we kind of get confused and we kind of like argue why this one might be right, but then this one's also right, so like which one's the correct answer? And it's just a whole different learning style to get used to just to take the exams. Even if you don't actually understand the content yet, because, you know, you're not in school yet, which is fine, just answer the question to the best of your ability and let it give you the rationale for why that's the correct answer. And even that, I think, will help you tremendously, because it's going to show you why they want that answer over another answer. And also, there's a very specific type of question that we get on these exams called a select all that applies question, and they're brutal because basically, instead of answering the question with one correct answer, we might have 3 or 4 out of the 5 or 6 answers that are correct. So if we put 3 answers but there's 4 correct, we don't get credit. If we put 4 and there's only 3 correct, we don't get credit. So we have to be bang on correct to get the credit on those questions, and I think a lot of us mess up on those ones. I know me personally, once we've had our exam reviews after the, you know, results have come out and stuff, I probably get like half of the select all that applies wrong, if not all of them, and so that's usually why my grade isn't what it could have been. It's not just for nursing school and for exams, it is for the NCLEX at the end of this, so you really need to know these, and if you can have a bit more of a grasp before starting nursing school, you're going to feel a lot more comfortable when you see those exams, I promise you. Okay guys, that is it for this video. I really hope this helps you in some way. I kind of went off on a bit of a tangent at times, but basically these are all the things that I feel like you should really know before starting nursing school. But yeah, hopefully this helps you, like I said, and like always, if there's any questions, comment down below and I'll get back to you when I can, and I'll see you in the next video. Goodbye.